Why do patients bargain? Why do they tell us that the dentist down the lane is charging less than you? Why do they do this? Hi, welcome to LDFS. I'm Dr. Lakshmy. Today we'll be discussing about why do patients bargain? Now, whenever you face some problem in your clinic, always try to find the reason behind that problem. And when you know the reason behind that problem, finding solutions is very easy because you know that it has to be related to the reason why the problem has occurred. So, in this video today, we will be understanding why do patients bargain. And in my next video, we'll discuss how to tackle bargaining patients. So let's get started. Patients bargain because of three fundamental reasons. The first is oral health awareness. People lack awareness about oral health. Even majority of the literates don't know that oral health can affect systemic health. They don't know the negative impact of having a poor oral hygiene. That is why whenever they'll get the treatment done, dental treatment done mainly only when they are facing some issue. The dental as such health and everything is the least priority to them. Imagine if somebody has got a heart attack and then he went to the hospital and there the doctor has told him to undergo some surgery. Will the patient bargain at that time or will he ask the doctor to get the treatment done? So that is the difference. Whenever a patient comes to us, we have to convince them that the treatment is necessary for their benefit. So the whole awareness is not there. So they feel that bargaining is okay for the dental treatments. So that is the first main reason. Their awareness is not there. Second reason is the discount mailer. There are so many discounts which are right now available by, which are right now given by various dental clinics around you. People are confused. They are seeing one day or the other one like 10% discount on the treatment, 20% discount on the treatment, $4.99 you can get the scaling and x-ray and specialist consultation and all those things. And this whole discount scenario confuses the patient because they feel whatever we are offering them, the charges are too high and they feel that they are not getting a good deal. And this discount scenario, or the problem rather, is created by us dentists, and now it has become a problem for us. Now I'll tell you how it is created by us. If we are not getting any patient, or even if the patients are not getting converted rather, then what we'll do, we'll reduce our charges so that we'll get more patients, and then we'll feel that okay, now the patients are getting converted, so this strategy works. But actually this doesn't, because whenever we reduce the charges, whatever we are attracting are only the price sensitive patients, and trust me, they will still bargain on that price. Even if you are offering 400 rupees for a root canal, they'll come and they'll bargain on that also, because they know that you are giving discounts. You were charging maybe 2,500, now you are giving it for 400, so that is okay, you can bargain with them. So they are so used to the discounts and all those offers which are around them, they feel that they need to get the best deal when they are getting the dental treatment done. It's sort of like we wait for the lightning deal of Amazon, right? Same scenario. They'll come to you, they'll say, we need discount. There are so many other clinics which are providing 10%, 20% discount. Why are you not providing? That is the second main reason why they bargain with us. Third reason is the value of treatment. Now, here I'm not discussing the cost, but what value are we adding by doing that treatment? Now, if you're charging an X amount and the other, dentist is charging X by 2, how will you justify that? Why are you charging X? So you have to make the patient understand that the value of what you are adding to them. You offer three different types of caps: ceramic and zirconia, etc. They should understand, why are we pushing for zirconia? Why is it better than the other ceramic caps? If they don't understand what value are we adding, they won't be happy to pay that extra amount. Even when you go to a hotel and you want to book a room, there are three different types of room which will be available. Some, take for example deluxe, super deluxe, and something else. Now, they will add some value to every room. They'll say, okay, okay, this is having a tub, and this is having, maybe a mini fridge and all those things, etc. So that is how they justify for the increase in the price in the room. So same scenario is applicable to us. When we are, telling them about three different caps, we need to make them understand the value which is adding in each cap, and why is the cost different. The quality of material which we are using for root canal. If you are charging 10,000 for a root canal, and people do, okay, there are dentists who charge 10,000 for root canal, but they justify that by having a microscope maybe in their clinic, or the infrastructure is such that it will resonate with the amount of money we are charging. So everything has to be balanced. They need to see some value in it. Now, there are so many clinics which are dental spa, where they provide, spa-like environment. Do you think they'll charge 400 for a root canal? No, right? Because even if, any patient who is going there, they'll expect that the charge will be high because they are getting so many amenities there. So that applies to us also. When you are, charging something, maybe 5,000 for a root canal, you need to make them understand that it's a single sitting RCT. You are using rotary and so many things. You are using the high quality material, etc. So that is how you can add value to the treatments you are suggesting. So these are the three main reasons why, if they don't understand the value, they will bargain with you, because they feel that if I am paying for it, I should get more. So if I'm not getting anything extra, let us reduce the price. That is the attitude which they have. So these are the three main reasons why patient bargain. First is the oral health awareness is not there. Second is the discount mela. Third is the value for treatment is not known to them. So these are the three main reasons. In the next video, we'll discuss about rather how to tackle the bargaining patients. I hope you like this video. Kindly like, share and subscribe us, and let us know in the comment section what do you think about bargaining patients, and how did you tackle those cases in your clinic. And if you want us to add you to our broadcast list, kindly send us a hi on this number, and we'll add you to our broadcast list on WhatsApp. Whatever free content we are releasing online first will be sent to the WhatsApp broadcast messages. And don't forget to save our number, or else you won't be receiving the broadcast message. Thank you so much, guys. Bye.